Hi everyone, I hope you're well. In this video, I'm going to show you how I use number 12 blade to remove excess material from interproximal area. So when it comes to Hi everyone, I hope you're well. In this video, I am going to discuss about different methods you can use to remove any excess material you have interproximally while you're doing direct or indirect restoration. So there are a few ways you can remove excess material. You can use a burr, very fine burr. You can use some of this scaler, which are very sharp in order to remove the excess material. You can use number 12 blade to remove excess material. The problem with the burr is control. You can end up damaging either side of the tooth. Scaler many times may not be powerful enough or sharp enough for you to be able to remove some of this composite material which has bonded to the tooth and is sort of overflowing around it. And that's why my go-to method is using number 12 blade. And in this video, I am showing during one of my courses, which I'm doing full mouth reconstruction course, I'm showing the candidates how I use blade, number 12 blade in order to remove excess composite material. With regards to this, it's very, very important when you're using number 12 blade, always away from you, okay, and use two hands. So obviously the mouth will be fixed. You're going to use thumb. You're going to use thumb to push, the right hand to guide. Always don't do like this. Okay. So you want to hold it where you want this to work. Where the you'll feel it. Okay, this is where my sort of excess is. Can you see it's catching? Yeah. So I'll put it there. Put my thumb there, and then I'll move this like this, like inside, outside, like I will twist it, but this is the thumb which is going to push, okay, like that, okay. Even if I'm doing like this, I have a finger here, and it's going to cut, and you can really, and it's controlled because. So I hope you found this short clip useful. So what I am explaining here is that I use two-handed technique when I'm using blade. I'm not just using one hand and using jerky movements. I would use two hands, and I would use my finger to support the blade, and that's how I guide my blade wherever it needs to go. Obviously it's a single use, so you remove it, and that's why every time you use it they are sharp, so you need to be careful and you need to be experienced. So when you are using this technique, tip number 1, start with anterior tooth, make your life easy. When you're learning, you could use it on models, but in the mouth it's much more easier than on models, believe it or not. So try using in the mouth when you're doing anterior restoration. It's very, very helpful, very easy. Make sure that you have number 12 blade ready to use, because most of the time what happens is that you've done the restoration, you're running out of time and the blade is not ready, and then you don't feel taking the blade out, taking the handle out and then using it. So make sure you keep it ready and make part of your indirect or direct restoration protocol that it's out there for you to use. If you are using matrices, then better adaptation of matrices can avoid this type of issues where your restoration has flown interproximally. So make sure you try and check the adaptation first, because if you have good adaptation, then you avoid that kind of issues. For indirect restoration, make sure you clean all the composite first, like we discussed in previous video. If you're doing bonding using restorative composite, it's very easy for you to remove all the composite and take your time. Make sure you clean all the composite. So instead of using normal floss, I use super floss to clean my composite interproximally. It cleans it really, really well. Many times if you just use floss, then you still can end up with leaving a lot of material behind, and once it's set, it can create a problem. So make sure you tick all these 3 boxes. I hope you found this video useful. If you have, please share with your friends and colleagues. If you have any questions, you can ask me on social media or go to my website www.drdevangpatel.com. In the next video, we are going to discuss why dentists fear about full mouth reconstruction, why they are fearful of doing full mouth reconstruction treatment.